My name is Michael Beckish. I am a pediatric orthopedic surgeon and I work for Greenville Hospital System. We operate on a vast majority of patients. We do scoliosis, a significant number of scoliosis. We do club feet, we do cerebral palsy, we do spina bifida cases. Anything that walks in the office and needs surgery we'll handle. I did my undergraduate work at Penn State University. I went to medical school at the University of Minnesota. I did my residency at Duke University in North Carolina, and I did a year of specialty training at the University of Utah. The reason I probably chose orthopedics is growing up the son of a football coach. I spent my entire childhood in locker rooms, in training rooms, and being around people who were hurt, and that it was just a natural fit for me. I think if you look at most orthopedics, they have an athletic background. They've either played sports or they've been heavily involved in sports, and it was just a natural fit for me. Pediatric orthopedics is significantly different than general orthopedics in that it could almost be a different subspecialty. The training is so different. You cannot treat a child the same way you treat an adult. I think most people know that. And so many orthopedic surgeons are uncomfortable treating pediatric conditions. A lot of the training is insufficient. And so having spent a full year doing that and making it my life's commitment, there are things that I see that become comfortable with that if I wasn't doing this every day, I would feel uncomfortable treating. My approach has always been to treat the child and to address the child. And then after I've talked to them and examined them, try to fill in the blanks with a parent, and then spend as much time as need be discussing with the parent. The thing that I think I do a little bit different is the parent's not my patient, the child's my patient. And so I think if you address them, things just seem to go better. There are a number of ways to try to ease the parents. One, you let them know your experience. You have a long talk with them about the potential complications, how you expect cases to go, what will happen if things don't go as you expect them to. And I think the biggest thing is just being receptive to their questions and their fears, letting them know, like I said, every parent, there's nothing worse, and the only thing worse than being operated on is having a child operated on. And so I think you're just open to them, you listen to them, you get every question that they have out. I try to spend as much time as necessary in the office, but I also spend a significant amount of time preoperatively with them. So many of the children we operate on, they don't reach the age of reasoning by the time they're going to surgery. And so I think it's a hospital-wide approach. That the hospital has hired someone, a child care specialist that has always seen the patient before we are. They are addressed in the pre-op area. They're addressed at their preoperative workup at Cross Creek. And so the hospital has really done a good job of trying to allay the fears that children will have and addressing those specifically. But as a physician, that's difficult to do, because once the decision is made for surgery, then no child wants surgery. There's never one that I've met that wants surgery. And so as they get older, you're more able to reason with them. And a 3 or 4-year-old or a 2-year-old, there's just, you tell parents they need it, and then address the parents' needs specifically for their surgery. We see close to 100 patients a week, pediatric patients a week, and so it just comes with experience. I'm not to say that other people can't do it well, but when you have that experience, it lends credence to your approach. I've been married for 15 years. I have 3 children, a 13-year-old son, an 11-year-old daughter, a 9-year-old daughter, and we take every advantage of the upstate that we can. We're at the lakes, we hike. My children are heavily involved in swimming, all 3 of them competitive swimming, so we travel the state for swimming, and we like to travel.